The highly infectious disease, Mpox, has been declared a public health emergency of international concern by the World Health Organization. Formerly known as monkeypox, the disease has rapidly spread across Central and East Africa since the start of the year. The initial outbreak began in the Democratic Republic of Congo, which has since registered 15,600 cases and more than 500 deaths. Health officials warn that this new strain of Mpox may be the deadliest yet. It starts with flu-like symptoms and escalates into severe complications. This is the reality of Mpox, a disease that has become all too familiar in the Democratic Republic of Congo. The virus, once known as monkeypox, is common here but is now spreading more widely. It can be transmitted through physical contact or via the air. 5-year-old Srin has now recovered, but her experience was terrifying for her mother. Srin had a high fever, followed by lesions on her body, rashes on her arms, abdomen, and even her tongue. Her mother was told it was a serious illness that could be fatal, so she rushed her to the hospital. While Mpox can be sexually transmitted, in the crowded camps of eastern DRC, most patients are children. So far, there have been 130 suspected cases, with half of them being children under 5 years old, and only 5% of cases are adults. The most common way to contract the disease is through direct contact with an infected person, and in these camps, children often play together. The latest outbreak has claimed 450 lives in the DRC. A new variant, called CA1b, appears to be more virulent and dangerous. This variant has now been detected in neighboring countries, including Burundi, Kenya, Rwanda, Uganda, and the Central African Republic. As a result, the World Health Organization has declared a global health emergency. A coordinated international response is essential to stop these outbreaks and save lives. A public health emergency of international concern is the highest level of alarm under international health law. While it is possible to vaccinate against Mpox, as has been done in previous outbreaks, vaccines are not widely available in the DRC, where children must rely on their immune systems to fight the disease. The WHO warns that if more isn't done to stop the spread of this new variant, the consequences could extend far beyond these camps.